The Minister of Health committed to constructing and renovating functional theatres and wards in 37 Health Centre 3 and 4s as per the manifesto of 2021 and 2024, and also planned to construct 500 staff houses for health workers.
The status is that so far, a total of 976 staffing units have been constructed and over 100 old ones have been renovated. There is a challenge attached to this. Less than 20% of staff are housed at the health facilities.
The Minister of Health, Dr. Ruth Aceng, presented the sector performance report during the NRM Manifesto week, indicating progress in human resource, medical supplies, and other key sectors. The ministry's commitment also extended to the construction and renovation of a number of hospitals, as well as 5 equipment maintenance workshops in Gulu, Masaka, Mbarara, Entebbe, and Kayunga.
The status is Gulu Regional Maintenance Workshop was equipped through leveraging strategic financing project by Enable. The remaining 4 are not yet constructed, neither are they equipped due to lack of funding. So we achieved 1. However, take note that the majority of the 16, we have 18 regional referrals, 12 of them have maintenance workshops.
The ministry also committed to completing and commissioning a state-of-the-art National Medical Store warehouse in Kajansi, Wakiso district.
Here the connection is, integration of the NMS client self-service portal with the NHDW has been done and all health facilities are ordering online.
The health sector made significant investment in the training of health workers, with about 47 senior consultants and consultants recruited in the 2021-2022 financial year and posted to various hospitals.
In financial year 22-23 and 23-24, there was a general wage enhancement for all health workers following a payroll validation. More consultants are said to be recruited in this financial year. However, we have a limited number of specialists in some disciplines, notably pathology, anesthesia, and radiology, that need an affirmative action through provision of scholarships. 2 was to provide scholarships for training specialized and super specialized cadres for Mulago and the regional referrals. The status is so far 99 masters and fellowship scholarships have been awarded. In addition, 41 scholarships for bachelors of anesthesia were awarded under the AMCHIP project.
The Minister of Health also began the digitalization of health facilities to connect them to the national medical stores. Significant strides were also made in the prevention and control of communicable and non-communicable diseases.
That we are on track to achieve the 95-95-95 targets for HIV elimination by 2030. Our ART coverage is at 98%. We have 1,403,603 people who are on treatment out of the 1,433,337 people living with HIV/AIDS. Our coverage increased from 91% in 2020 to the current 98%. So for ART coverage, we are above the 95 target. In regards to TB, significant strides have been made to control the TB epidemic through the implementation of the National TB and Leprosy Strategic Plans 2020-2021 to 2024-2025.
The minister noted that the retention for antiretroviral treatment dropped from 77% to 83% in the financial year 2021-2022. The ministry also remains committed to developing the Uganda Virus Research Institute into a world-class centre of excellence in health research.
This is ongoing. The challenge is largely availability of finances. But we all know that UVRI is already carrying out world-class research in collaboration with many international universities, including a research on vaccine production, a research on injectable ARVs, and many others.
The Ministry of Health under Human Capital Development was allocated 10.2 trillion shillings in the 2024-2025 budget, representing 27% of the national budget. At least 2.9 trillion shillings was allocated to key priority areas including promotion and implementation of disease prevention interventions, provision of essential medicines, with an additional 100 billion shillings allocated for improvement of welfare for health workers, including medical interns and doctors, construction and rehabilitation of more health infrastructure, and provision of medical equipment and digitization of the national health system to facilitate service delivery. So far, the number of health centre fours providing caesarean sections and blood transfusion has increased from 50%, that is 108 out of 218 in 2020 and 2021, to 64%, that is 132 out of the 254. Mutonyi Hilda, UBC.